I'm already a licensed massage therapist for Missouri, but that doesn't really help for here because there's different licensing for different states. Have any of you ever received a massage? Good. A lot of people say that they haven't. Clinical or spa?
Spa.
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 Clinical.
I'm actually a clinical massage therapist, but I have minor training in spa. The definition of massage therapy, as taught to me at my school, is the art and science of deductive reasoning applied through soft tissue manipulation to enhance emotional and physical well-being. It kind of doesn't sound very good for the common person to understand very well, but that's the Webster's definition. Complementary and Alternative Therapies in Nursing says that massage is a proposed mechanism for relaxation to reduce psychological and physiological stress, which it does through lowering your cortisol levels. It's used to increase circulation, relieve pain, induce sleep. Not induce sleep, it's improve sleep. That's what they say, induce sleep, but it's improve sleep. Reduce anxiety or depression, and improve quality of life. Technically, I was diagnosed with severe anxiety about a year ago, and I know for a fact that it helps. At least it helps me. It affects multiple body systems, not just the skin. It affects circulatory system and musculoskeletal system and the nervous system, which is probably why it helps with when you're nervous. There are a lot of different modalities. There are pages and pages and pages of different modalities, but the ones that I'm trained in are neuromuscular therapy, aromatherapy, qigong, which is one of the original Chinese massages, reflexology, hydrotherapy, deep tissue, but I'm not very good at it, and trigger point therapy. I don't get enough pressure to do deep tissue. If you look on the internet, you can find pages and pages of supposed benefits of massage, but a lot of it you can tell is biased opinion, not necessarily proved. But their proven benefits are that it warms the skin, relieves muscle tension, reduces stress, anxiety, depression, and pain, encourages connectedness, and bolsters immune function and improves sleep. Like all treatments, massage has contraindications and cases where you shouldn't seek it. Cases where you'll be turned away and they won't massage you at all are if you have a fever, any contagious disease, and any recent operations or injuries, because you don't want to make it worse. And say she has some, she has a cut here, then we would not massage here. We would just do the rest of the body. So that was what we call a local contraindication, and those include varicose veins, bruising, or inflammation. So if you get a massage while you have inflammation, it can make it worse, and you don't want to do that. The body's already trying to heal that section, so you don't want to impede its working. When to see your doctor. If you have a long-lasting or chronic pain, you should probably seek your doctor first. And then if you have any dramatic changes in your body, such as bowel or bladder changes, an increase in pain after the massage, feeling faint or dizzy, you should seek your doctor as soon as possible. According to massagetherapy.com, if you are under a doctor's care, it is strongly advised that you receive a written recommendation for massage or bodywork prior to the session. If you are under the care for certain illnesses, then the massage practitioner could turn you away out of hand, or may require you to bring in a note from your doctor saying that it's okay, that they recommend that you get this treatment. Also according to massagetherapy.com and many, many other sources, massage is one of the oldest healing arts. It has a long line of use. roots is in traditional Chinese medicine, and one of its other roots is from paintings in Egyptian tombs. Self-treatment techniques. This is by this lovely lady right here. If you ever notice that whenever you hurt yourself or hammer to the thumb, you're gonna, my thumb, and you're gonna rub it, see if it makes it feel better. That's because touch overrides pain in the brain. There's a lot of studies that prove that. So whenever you're trying to help that pain go away, self-treatment techniques include effleurage. Effleurage, which is just gentle stroking like this. Most massage therapists will rub towards the heart to help with circulation. Then there's petrissage, which is just kind of like picking up the muscle so that it increases blood flow. And then most other that was all, I'm sorry.
No.
Most other treatments that are recommended for home care or self-care are hydrotherapy, which is like taking a nice bath and Epsom salts and stuff, or hot and cold packs, which if you go to a massage therapist, they'll probably try to sell you. I recommend trying that first, but if it's something you can't reach or something, I'd see my doctor, and then if he recommends it, you could come and see me. Education, according to Aromatherapy Essential Oils in Practice, education requirements for a massage therapy license vary from state to state. That's why I don't have my license for here yet, because I'm still technically certified in Missouri and I haven't gone through the application process for here. It's also because I'm going to Minot State. Fun fact, in Minnesota, Wyoming, Kansas, Oklahoma, Vermont, and Alaska, there are no massage regulations, which means anybody who wants to say that they're a massage therapist and sets up a business can say that they're a massage therapist.
What states were those?
Minnesota, Wyoming, Kansas, Oklahoma, Vermont, and Alaska. So if you walk into someplace in Minnesota and they have a license over the counter, they're probably one of the better massage therapists. That's why I would probably seek to see if they have a license before I got a massage in any of those states. Most massage therapists use the same techniques, but I have extra training in neuromuscular therapy, which is it's a therapeutic massage, which is the clinical side, and my specific techniques include the effleurage and petrissage, trigger point therapy, and that neuromuscular therapy. Trigger point therapy is if, say, I'm giving her a shoulder rub and I find that she has like a small bump here. It's not necessarily like cancer or anything, because people are always worried about that, because if it's like tender to touch, like they call it hypersensitive. If I press on it for a little while and then it gets better, and then press again and it gets better, we do it 3 times, that's trigger point therapy. Neuromuscular involves muscle testing, like if I go like this on her shoulder and she tries to push up against my hand, if I go like that, then she'll have less of a response. If I tighten the muscle or bring the kind of touch the ends further together, then she'll be stronger. Yeah. So inadvertently, whenever we hurt ourselves, like you get smacked on the arm or something and you rub it, you're turning off that muscle. It's what they call turning it off. Okay. And that helps ease the pain because you're not as focused on it because it's not active. Certain modalities that most massage therapists will offer are hydrotherapy, which is like the heat packs, hot and cold stone massage, body wraps, scrubs, and reflexology. Everybody loves a foot massage. In conclusion, I hope that the information I've imparted to you has given each of you a better understanding of massage therapy. And maybe you'll try one. Thank you.
Thank you.
Whereabouts in Missouri.
I,
Missouri.
yeah, the closest, big town I live near is Springfield.
So where were you from then?
I'm from Long Lane.
Oh,